Are underage boys in Nova Scotia getting their bits removed in sacrifice to the trans gods? I've investigated the province transgender healthcare reforms, and the more I look into this, the weirder it gets. True North received a heap of FOI documents telling the story of trans healthcare policy changes in the province, and what I found was worrying. In 2023, Nova Scotia's progressive conservative government approved a sweeping overhaul of its transgender health policies. Today, aligned groups like Pride Health, Nova Scotia Health, IWK Health, which is a hospital in Halifax, and a host of doctors and politicians, activists and bureaucrats collaborated to fund and approve irreversible medical procedures for minors, and to train doctors using activist materials and sell ideology as medical evidence. I'm Melanie Bennett. This is Disrupted. The information we received is pretty insane. It's a comprehensive compilation of internal emails and policy memos, confirmed surgical data, all obtained with the assistance of a group called the Citizens Alliance Nova Scotia. The situation in Nova Scotia is so fraught that the source couldn't even apply for Freedom of Information documents in their own name. They had to use an organization like CANS to act as representatives. So I asked CANS why they decided to help.
So, Citizens Alliance of Nova Scotia is a public interest nonprofit registered in Nova Scotia, Canada. And one of our missions has always been to provide a kind of protective corporate vehicle to assist in actions that might otherwise be risky for individuals to take by themselves. It's why I prefer not being on camera. It's for the sole reason of protecting myself from harm meant to distract or scare me from helping others. To give you an example of our mission in action, researchers, therapists, or doctors can face a lot of difficulty retrieving data that is either perceived as being or is counter-narrative. Openly requesting such information for the purposes of critical analysis and distribution puts this group of truth seekers at risk of being ostracized, professionally reprimanded, or even on the receiving end of legal difficulties. And it's all to prevent information from being disclosed that may make the public question common narratives that are driven by government or other publicly accountable organizations. The concept of a corporate entity acting as a shield to protect those who are trying to uncover relevant information without censorship or obfuscation by the data-holding entity can be, and actually has been, very successfully applied, particularly in the arena of freedom of information requests.
In short, even requesters of publicly available information have to protect their identities to avoid backlash. So let's get to the data. Let's dig in, shall we? Most people expect that health policy is shaped by evidence and a healthy dose of caution when dealing with removing healthy body parts. But in Nova Scotia, when it comes to transgender health, that's not in the driver's seat. So we're going to start with Lisa Lachance. Lisa Lachance is an NDP MLA in Nova Scotia, and she was or is the president of Queer Momentum, a non-profit, and she was previously the executive director of a consultancy called Wisdom to Action. And together, these two activist organizations received a lot of money from the feds. Between 2020 and 2024, both entities together received about $1.6 million from the federal government in grants. And Lisa Lachance is listed in the consultation documents as the facilitator of something called the Queer Forum. What we do know is some of the details of the Queer Forum are redacted, and so we don't necessarily know all of the attendees, but we do know that they discussed topics like expanding Pride Health and DEI policies. That includes several mentions of something called cultural competency training, increasing surgical capacity, making more surgeries or approving more surgeries basically, funding activist-aligned research, adding preferred sex and pronouns to their clinical information systems, funding name changes, freezing eggs, travel and accommodation costs in and out of province, and even funding something they're calling cost of living supplement, which looks like it's an additional supplement to EI for those who are off work for a longer period of time. So basically, it's all about making surgical transitions as easy and fast as possible, whilst being fully funded as possible. And for La Chance to be facilitating this forum seems like a bit of a conflict of interest. La Chance is in charge of entities who receive funding for the elimination of any kind of safeguards on trans medicalization. She's facilitating decision-making that will transform trans health policy into something that's fully aligned with her own agenda, all while acting as a sitting MLA. It looks like La Chance isn't representing the public interest as much as she's representing special interests. And the Progressive Conservative government in the province appears to have noticed. Last year, they put out a statement calling out the obvious problem with La Chance's activism while acting as a sitting MLA. They pointed out a lot of the funding that one of the companies received, pointing out that she got paid for things like women's programs, victim fund, a whole bunch of things that are not necessarily only aligned with the LGBT community, but the fact that she was getting funded and pursuing that activism as a politician. But nothing seems to have really come from it, though. The FOI shows that Health Minister Michelle Thompson was provided with a cheat sheet to argue for this transformative healthcare policy in the legislature, and it went ahead. I don't know, it seems like a damp squib if I ever saw one. Throughout all of this was Pride Health. You've heard me mention it before. It's a partnership between Nova Scotia Health and IWK, that hospital I was talking about in Halifax, and it brands itself as a support system for queer patients. The Pride Health leadership team includes Gary Dart, he, she, they. His LinkedIn says that he's a professional development consultant for IWK Health and previously acted as healthcare coordinator for Pride Health. He also worked for the now bankrupt, among quite the controversy, I might add, Canadian Centre for Gender and Sexual Diversity. Now that's a whole story, and I think that you should go down that rabbit hole. Eesh. But Gary is a self-proclaimed activist who also runs his own consultancy. His email signature says it all, really. But if that's not enough for you, let's check out his website. It says, lowercase t they, uppercase she and he is a queer, gender-fluid Newfoundlander who strives for systemic change through advocacy, activism, and the use of decolonial and anti-racist practices. They've worked and volunteered for basically activist organizations for years. So the guy's developing professional training for clinical staff. Gary has a degree in ecology and conservation biology, which incidentally is the same undergraduate degree that I have. And he has a certificate in some activist stuff on top of that. So to me, that doesn't sound like Gary is really all that suitable to develop training for medical staff about surgical matters. Except apparently it's just fine, because Gary greenlit mandatory training for clinical staff based on materials from the community-based Research Centre, which is another federally funded activist nonprofit dressed up as a research institution. The CBRC created training modules related to hormones, drugs, affirming practices, surgical readiness, all for $5,000 a piece. From the looks of it, but I can't really tell how many actual modules that they produced, only that this FOI contains mentions of 3 or 4 of them. Now, I looked it up, and the CBRC received over $26 million in federal grants since 2017, including $14 million in spiked in 2022. CRBC received over $26 million in federal grants since 2017, including a spike in 2022 of about $14 million. This is a group that's closely aligned with Lisa Lachance's Queer Momentum. Here's Faith Johnstone, Lachance's business partner at the CBRC Summit in 2024.
We can also reject the premise our opposition is putting on the table. This is not a fight between children's rights and parent rights. Again, this is about schools where everyone has the freedom to be themselves. If we allow them to set the narrative, we will lose these battles. Because, shockingly, the term parental rights is really appealing to people. Who would want to have the rights of parents taken away? Of course we wouldn't want to take away the rights of parents doing their best to raise their kids. And so we have fallen for their trap on this issue and many others. We need to be speaking with one voice and shaping the narrative, again, about schools where everyone has the freedom to be their authentic selves. And if and when we can, we need to make parallels to the experiences of others. And there's a dangerous dance there, because the experiences of queer and trans people of different communities impacted by oppression are not identical and should not ever be equated with one another. But we can help folks understand that many of us in our schools have experienced teachers who don't understand who we are, have had teachers screw up our names or look at us and make assumptions about our bodies, our faiths, our cultures, and how we live our lives because of identifiable traits. And so we can reject the premise of their argument and use a frame that actually builds community together and that rejects their narrative of exclusion, their narrative of division.
So Gary and CBRC created and approved and developed this training on a platform called MainPro Plus, which is the Continuing Professional Development, or CPD, platform for doctors from the College of Physicians of Canada. Doctors need training from these guys to get certified in certain areas. So it's a big deal. And so why are they putting activists in charge of training doctors on medical best practice that they might need to use to get certified? WPATH. Let's talk about WPATH. The World Professional Association for Transgender Health is the group behind what's called the Standards of Care, or SOC, or SOC. These are documents that advise doctors, clinicians, and policymakers on how to approach transgender care. And up until recently, WPATH was considered basically the gold standard, but things have most definitely shifted on this after details emerged of what they're up to. Canada's very own Mia Hughes exposed the massively unethical and unscientific practices of these doctors, activists. But if you haven't read the WPATH files, I highly recommend that you go and have a look through those. So here's what people don't always realize. WPATH isn't a medical organization. It may have doctors among its members, but it's yet another activist organization parading as a legitimate medical group doing legitimate medical research. Their latest version of SOC 8 removes nearly all age minimums for surgeries, even for minors, going as far as recommending bottom surgeries for boys as young as 14. It promotes something called individualized assessment, which sounds thoughtful until you realize that it gives clinicians a blank check to greenlight major surgeries on teenage boys and girls with little or no safeguards. Internal chats within the WPATH files that were revealed show that the doctors knew that many kids didn't fully understand what they were doing when they agreed to these surgeries, especially kids with autism, trauma, and mental health struggles. The WPATH members knew what they were doing wasn't exactly kosher, but they did it anyway. Members admitted that puberty blockers might interfere with sexual development or long term, while others said that sterilization is a real risk. But the affirming model doesn't leave room to slow down, and they just went on. So one of these doctors, Gail Knudsen, a former president of WPATH, was consulted directly by Nova Scotia Health on 2 separate occasions. Knudsen co-authored WPATH's identity recognition statement, which calls for the elimination of all barriers to transition, including for minors, and explicitly pushes for government-funded surgeries. But it seems that Nova Scotia Health were all too happy to oblige. The FOI reveals a sharp increase in approved applications for surgery, which doesn't look like it was going to erase anytime soon, as Nova Scotia has the highest proportion of trans and non-binary people than any other province in the entire country. The cost to the public for this care is significant. Nova Scotia is a tiny province, but it budgeted $1.7 million for gender-related healthcare in 2023-24 alone, and that figure doesn't represent a fixed cap. The internal memos from the FOI states that the department basically encouraged the government to adjust the forecast upward, basically demanding that the funding increase should they need it. So there's no cap on how much they're willing to put into transgender healthcare. Between 2021 and 2024, the province spent just over $2 million on 187 mastectomies for people of all ages, including minors. That doesn't really include the other costs associated with it, so things like binders or prosthetic genital devices, travel, accommodation, so on and so forth. Then we have Dr. Pierre Brassard. Brassard runs the GRS Montreal Clinic. It's a private clinic contracted by Nova Scotia to perform out-of-province bottom surgeries. And that includes vaginoplasties, orchiectomies, and phalloplasties, amongst other surgeries. Basically, he amputates and reshapes genitals to resemble the opposite sexes. When I reviewed the FOI data, I found that 5 vaginoplasties were performed on patients under the age of 19 in a single year. Now, that doesn't mean that all of them were under 18, but it could mean at least some of them could be. The data was compiled for MSI, which is the Nova Scotia health insurance provider. So to me, it seems an odd choice to have a column that says under 19 and another column for over 18. If the data is meant to show adults versus minors, and we're talking about surgery, why not just have an over and under 18? That would make more sense. Were there kids in the under 19 category? I tried to contact Stacey Burgess directly to ask her those questions. I wanted to see whether the minors were actually undergoing surgery. And curiously, she said yes. According to Stacey Burgess, this aligns with the provincial policy. This is where things get a bit gray, though, because the policy says that in some cases, minors 16 and over, which would be, I guess, in the under 19 category, can access medical procedures if they show emotional and cognitive maturity. But it doesn't really specify which procedures. I asked Dr. Brassard, too. He told me that his clinic only performs mastectomies on patients 16 and over and never any bottom surgeries on anybody under the age of 18. Curiously, the clinic responded to my request for comment weeks after the deadline for the publication of my article, so that information never made it into the original article. What the clinic is saying does track with the WPATH files revelations, where he's discussing bottom surgeries on boys. Essentially, a bunch of doctors, including Marcy Bowers, who is Jazz Jennings' doctor, are discussing whether it's appropriate or not to do bottom surgery on kids the age of 14. And, you know, they're trying to settle on the age of 16 being the most appropriate age to make them look as female as possible. And Brassard at the very end says that his clinics don't perform any bottom surgeries for boys for anyone under the age of 18. So what's going on here? The legal age of majority in Nova Scotia is 19. Does Stacey Burgess refer to 18-year-olds as minors? I don't know. Why would you say that minors are being approved for genital surgeries while pointing me to a policy showing that 16-year-olds can access these surgeries? If not Brassard, are the genital surgeries on boys being performed by someone else? Is Brassard's clinic telling fibs? On this particular issue, things are as clear as mud, and I'm not quite sure what to make of them, quite honestly, and nobody will give me further answers. I reached out to Premier Tim Houston and his health minister to get comments on this, but crickets, they didn't get in touch, they didn't respond. Are they cool with this? Did they know about it? If not, am I informing them of something new? Are they going to do anything about it? Not a peep from any of them. And now Brassard's GRS Montreal clinic is facing heat. Lois Cardinal, an Indigenous trans woman from Alberta, has filed a lawsuit against Brassard's clinic, claiming he was rushed into a vaginoplasty without proper assessment, and his concerns post-op were completely dismissed. Now, in Canada, this is a landmark case, and it's one of the first to challenge trans surgery model in the country directly. And it just so happens it's the same WPATH aligned clinic that may or may not, but probably is, removing the genitals of young boys. So while other countries are banning this kind of thing outright, Nova Scotia is fully in the business of surgically altering kids. So that's where we are. A Canadian province is funding irreversible surgeries for minors. They're doing it with the guidance of activist organizations masquerading as medical authorities. The officials responsible can't or won't explain how these decisions are made, what risks were assessed, or why dissenting or critical views have been ignored. They've removed clinical safeguards almost entirely, and they've embedded ideological training into the hospitals. So why did the Conservative government of the province ignore these revelations? Are they fearful of the activists? My coverage of the story isn't over. If you want to download the details of the FOI and read it for yourself, please go check out my article in which I include a downloadable PDF copy for anyone to access and read. In the second part of this series, I will be joined by Mia Hughes, author of the WPATH Files and senior fellow at the Macdonald-Laurier Institute, and one of the few people in the country tracking the global fallout from trans ideology. I hope you enjoyed this episode. Please consider liking and subscribing and hitting the notification bell if you want to catch my next episode. I'm Melanie Bennett. This is Disrupted.